My nose is not blocked but I cannot smell anything. This is really frustrating because it seems like no matter what I do, no matter how many times I try to open my nose, no smell comes out. I've also noticed that when I blow really hard, no smell comes out either. So what could be the problem? The most common problems involving the nose are infections and irritations. The nose is a very small filter unit, just like our lungs. When there is an infection or a blockage somewhere in the system, the problems get worse. They can cause inflammation, pain, and even difficulty breathing. Blocked nose airways cause all of these problems and cannot be cleaned or treated with any type of medicine. When you have a nose that is not blocked, it doesn't mean you're not doing something to cause it. Even if it's completely blocked, something may be causing the blockage. For example, my nose is not blocked but I cannot smell anything. This is actually caused by a sinus infection. I would have never thought of this, but sinus infections and blocked nasal passages do happen. This is where your nostrils become swollen and inflamed so they cannot smell. Another cause might be allergies. Allergies cause a reaction in the body, so you could have something in your nasal area that is causing the reaction. If your nose is blocked, there might be something in your surroundings that causes the sinus infection or allergic reaction. Things like dust and pollen are common irritants that cause a runny nose or stuffy nose. A cold or flu can also cause your nose to swell and block it too. A fungal infection could be the culprit as well. Sometimes mucous membranes, the lining that surrounds your nasal cavities, can become inflamed and thick, causing stuff to enter. This can be caused by an injury, viral infections, or a fungus that lives in your nasal passages. Sometimes your nose is not blocked but I cannot smell anything, so you might be having a different type of problem. If you do have a blocked nose, a stuffy nose, or any type of inflammation in your nasal passages, you should see a doctor right away. Don't worry about it messing with your day. There are plenty of nasal medications you can take. You can also have surgery to remove the inflammation. However, the best treatment is prevention. When your nose is blocked, you should avoid taking in anything that will cause you to get congestion. Some people get mucus when they are exposed to certain types of irritants, pets, or foods. These can cause a stuffy nose, runny nose, red eyes, and more. Prevent this type of thing from happening by avoiding these triggers and always staying clear of them. If you are taking antibiotics, be sure to take the prescribed oral stuff or visit your doctor to make sure there isn't another problem causing your problem. If your nose is not blocked but I cannot smell anything through the nose, you may have nasal polyps. A nasal polyp is an abnormal growth in the lining of your nasal passages. This can cause a lot of problems, including difficulty breathing and sinus infections. If you have nasal polyps, you should see a doctor immediately. However, this problem can often be treated and cleared up easily without surgery. A deviated septum is another common problem. This is a change in the nostrils or septum, which often leads to an obstruction in your nose. As you get older, this problem is often aggravated. However, there are plenty of ways to treat and clear this up as well. A chronic sinus infection can cause you to have a stuffy nose. If this is the case, the best treatment may be to take anti-inflammatory medication, which can help relieve the pressure caused by the infection. If you have a cold, you may not be able to smell your own breath all the time. This is due to the congestion caused by the cold. Treating the cold can often solve the problem, and the anti-inflammatory medication can help to loosen up some of the stuffy nose mucus. If you smoke, this may cause a stuffy nose as well. The smoke sticks to the lining of the sinuses, which then traps the smell inside. To solve this problem, you need to quit smoking. If you cannot quit, you should clean the area around your nose and throat with alcohol every time you smoke. Also, avoid drinking alcohol after you have had a cold or flu. It is generally agreed that the accumulation of mucus in the sinuses makes it difficult for the nose to breathe and hence cause the blockage. But this is not always true. It may just be the case of a thickened mucus, which in turn may have resulted from nasal congestion caused by colds or flu. You can opt for nasal irrigation to flush out the mucus, if this does not work. If the above reasons could be the reason for the problem, then there are chances that a deviated septum may also be the reason. A deviated septum is when the septum separates from the nose. In such cases, the nasal passage starts receding towards the nose, which makes breathing more difficult. This may result in nasal swelling and pain. If you feel that this is the reason for your problem, then surgery can be done to straighten it. But this requires expertise on the part of a surgeon. Another factor which causes a nose to be blocked is dry air. As we all know, too much humidity and heating can cause the nose to dry up and become a perfect medium for bacteria to grow. So if you live in a place which is either very hot or very cold, the blocked nose may also be caused by this. To solve this problem, you can go for a humidifier, especially during winter months. There are many more reasons like structural imbalance, structural distortion of the nose, and the side effects of certain medicines which can cause nose bleeding, stuffy nose, and even chronic nose infection. These are the reasons why the doctor will order a rhinoplasty. The most common form of nasal cosmetic surgery is called a retidectomy. It mainly involves removing the extra mucous membranes in the nose that causes stuffiness in the nasal passage. You can even choose to remove your entire nose. This procedure involves detaching the skin on both sides of the nose and moving them forward and removing the bone and cartilage in the nose. In case you need surgery done on your nose, then you need to have a general anesthesia since it is a very delicate part of your body. The surgery may even cause some swelling and bruising, but this will subside with time. For possible treatments of nasal blockage, see the link below.